Dr. Chatterley, tell me about wisdom teeth. There's so much, terror out there about it. Everybody's afraid of having the wisdom tooth pulled, the 18, 20-year-old kids, and if it gets older, what is it with wisdom tooth which causes so much trouble?
Well, the development of the human species is interesting. The good Lord provided us with wisdom teeth in the mix of the gene pool over the centuries, over the thousands of years. Many people got big teeth, a little jaw, or vice versa, and so not all their teeth fit into place. If you examine, forensically examine skulls from thousands of years ago, most of those skulls have third molars that have been able to erupt into place. In today's population, most people don't have enough length in their jaw to allow that third molar room enough to come in. So it may come part way in, or may not even be able to break through the gums when it's time for it to erupt, and it's called impacted, meaning it's unable to erupt. There's several complications that can develop from impacted teeth. So it's commonly recommended, if people do not have sufficient space for all 32 teeth, the third molars of wisdom teeth being the third molar back there, and we start numbering teeth from over here and go around. So 1, 16, 17, and 32 are your wisdom teeth. If they don't come in to have them out, it's better gum disease-wise, it's better periodontally, and it's just better to have it done when they're younger and they're more, so to say, made of rubber, resilient, and have it out before complications can develop.
Okay. Now, is there's this fear, it hurts a lot, putting a wisdom tooth. I mean, the whole dentistry has this stigma. It hurts a lot. And frankly, if we're really honest with ourselves, as people who have gone to a dentist and had a little whatever done lately, it's just not anymore true, I mean, a root canal, a tooth pull, a periodontal thing, you get the injection and you guys numb us even before we get the injection. That wasn't around when I was a kid. The guy pushed a huge needle in it. That needle had a big hole like a pipe. I think my pipe in my water pipe is smaller. But it was definitely like a pencil. And but all that is not happening anymore. So is this wisdom teeth, this bad wisdom teeth or a root canal for that much? I'd rather have a root canal, than whatever. You see what I'm saying? Is that not anymore true? Is that really just a hangover from times when it maybe was more inconvenient and more hurting? Or is it still,
well over 90% of the time, I'd say it's a hangover. It's a bad reputation that's been passed down. Particularly when you mention root canals, the word root canal gets a bad rap, so to speak, because it's the toothache and the infection that's the decay getting down to the pulp, the infection within the tooth that's led to the toothache, and the root canal treatment resolves that and saves the tooth. So
the root canal treatment is the good guy, but it gets the bad rap, right?
It's like root canal is the good guy, but it gets the bad rap more often than not, because it's really the toothache that's the bad guy.
Don't kill the messenger, right?
Exactly. And as far as wisdom teeth, they can be complex extractions, and that's where at least in the state of Florida, the Practice Act being as it is, not that many general dentists are able to do IV sedation, but the patient has the choice to get referred to a competent oral surgeon that's had anesthesiology residency training, and they have the IV sedation, the Versed, or one of the drugs that's given to them. They are totally unaware of the whole process, They do get local anesthetic, and they're not even aware of. But bottom line is, in short order, it's over, it's done. Somebody takes them home, they recuperate, not a problem. We do in our practice take out a lot of wisdom teeth, and like you mentioned, we get them really numb, and they just loosen up and come out like other teeth. So yeah, we accommodate, give them the choice.
So obviously technology, especially in terms of numbing people, making them feel comfortable, and probably also the way of cutting into it and doing things simply has improved, and it's just not anymore spick and ordeal as it used to be.
Exactly right. It's much improved. The various anesthetics that have been developed are more effective. It's like Coca-Cola had the first name of, and all cola drinks are called Coke. Well, all anesthetics are called Novocaine. You don't even find Novocaine anymore. It's lidocaine and mepivacaine and septicaine. There's all kinds of different ones, and so it's much improved.
Wonderful. Well, thank you very much, Dr. Chatterley.